Hey, this is Dr. Scott Worden, the TOS guy. We're live streaming live from Sunnyvale, California. Hope everybody's getting ready for their holidays and in a good way with family and friends. Today's topic is a broad topic, so we're going to focus a little bit, but we're going to talk about thoracic outlet syndrome in professional athletes. I'm going to do a presentation and then we'll take some questions afterwards. Okay, this face is probably even more recognizable than mine, even if you're one of our biggest fans. This is Victor Wembanyama, the sensational basketball player very early in his career. And this next picture is Zach Wheeler. So besides both being professional athletes, they both were diagnosed with blood clots and thoracic outlet syndrome. The course of their the course of their story is a little bit different from one another, but we're going to use it as a springboard to talk about certain types of TOS that occur in professional athletes. So we're going to focus on basketball players in the NBA and baseball players in Major League Baseball. Keep in mind, though, that players at lower levels can develop the same exact syndrome. Some famous NBA players who were diagnosed with TOS include Victor Wembanyama, Markelle Fultz, who I believe in 2017 was the number one pick in the first round by the Philadelphia 76ers. Shortly after the season started, he developed all kinds of problems with his shooting and his mechanics and was eventually diagnosed with neurogenic TOS. He's one that did not undergo surgery. Van Uzo and Kyle Anderson are two more examples. You're going to notice here a trend: Major League Baseball players with TOS. A long list here. Some names you might recognize, such as Matt Harvey or Steven Strasburg. But there's more, and I could keep going for a while. So of the searching that I've done, a lot more baseball players have been diagnosed with TOS than basketball players. So let's talk about venous TOS in particular, because the two athletes at the headline of this story were both diagnosed with venous TOS. Venous TOS can occur in athletes who participate in swimming, water polo, volleyball, rock climbing, tennis, any overhand sport. Thoracic outlet syndrome can occur in athletes at any level from high school, college, up to professional. So let's go to Victor Wembanyama and start with his story. He was diagnosed simply with a right upper extremity blood clot in February of this past year, 2025. I read through the news articles and there was a tremendous amount of noise about blood clots, but they didn't go any further than that. Now, other NBA players have had blood clots, and here's a list with, again, some prominent names like Chris Bosh, Damian Lillard, among others. So these are not with TOS necessarily, but with blood clots. And here's where I want to make a couple of teaching points. When you read about blood clots, it's not as simple as that. It's a little more complicated, which we'll go into in detail. But when you see the words blood clot in any athlete of yours that you follow, I want you to think a step deeper. So let's find out why and where blood clots occur. Virchow, Virchow, was a very, very famous pathologist. Sometimes he's called the father of modern pathology. And he came up with his famous triad to list the three factors that, when abnormal, can cause abnormal blood clotting. The first one is slow blood flow. The blood needs to keep moving or it slows down and increases the risk for clots. The second, hypercoagulability, means that the blood clots too easily. This can be due to a number of processes. Some people are missing a vital protein or have too much of a protein in their blood, and they're at increased risk of blood clot, for example. And the third factor in Virchow's triad is blood vessel injury. The lining of the blood vessels, called the endothelium, secretes chemicals to guard against blood clot formation. Okay, so here are some examples. Slow blood flow. People on long airplane flights overseas, if they don't move enough, are at increased risk for developing blood clots in their legs. Hypercoagulability. People with cancer are another example of people who can clot their blood too easily. And then blood vessel injury. Some people get a venous catheter put in to administer medicine. That can injure the blood vessel wall and increase the risk for blood clot forming around the catheter. Now, where do blood clots occur? Common places include the legs, the lungs, and the shoulder or upper extremity. Rarely, blood clots will form in the internal blood vessels that feed the bowel or in the brain, but those are relatively unusual. Most blood clots, by far, occur in the legs. Only 5% of all blood clots that people get occur in the upper extremities. Now, if we look at all of those 5% of blood clots, 70% are caused by known factors like cancer, recent surgery, prolonged immobilization like being in a cast or unable to move, people with diminished mental status, etc., and estrogen use and pregnancy. So of the original 5% of all blood clots that occur in the upper extremity, only 30% of those are not explained by these risk factors. Turns out that of all upper extremity DVTs, deep vein thrombosis, 5% are due to venous thoracic outlet syndrome. So that means 5% of 5%. It's a very small number of all patients who develop blood clots. Now, when the people who have studied these things took the patients who actually had venous thoracic outlet syndrome, compared them to all the other people in that group with the unusual upper extremity blood clot, they found that the people who had venous TOS were more likely to be, excuse me, more likely to be male, significantly younger by 20 years, and they presented with this blood clot that was venous TOS. Patients with cancer will have little blood clots form in multiple places if they're going to be hypercoagulable. So remember this, male patients, younger patients, and patients who show up the first time with an unexpected blood clot, those are more likely to be due to venous TOS than to all the other risk factors we talked about. So go back to the location. The legs, by far the most common place to get a blood clot, but you can also get them in the lungs. I think Damian Lillard was one who developed a blood clot in the lung that is actually called a pulmonary embolism. So a blood clot in the lung, a pulmonary embolism, does not form in the lungs. It forms somewhere else in the body. A piece of it breaks off and it travels up towards the heart and gets trapped in the lungs, in the blood vessels of the lungs. Okay, pulmonary embolism is a serious disease, especially in younger people. It's one of the more common causes of sudden death in young people. So when doctors see it, a pulmonary embolism that is, they act relatively rapidly to treat the embolism and to find the source of the blood clot that created the embolism. Typically, we'll do an ultrasound of the legs looking for those blood clots, and then you have to treat that underlying cause. Now, here's a list of NBA players who had quote unquote blood clots. I showed you this list before. Let's take a look at Chris Bosh first. Chris Bosh was a great player, 11-time All-Star, along with Shaquille O'Neal and I forget the third part of the triad, Dwayne. He helped the Miami Heat reach the NBA Finals 4 straight years. And the following year, he developed a pulmonary embolism. Again, not a clot that develops in the lungs, but a clot that comes from elsewhere and travels to the lungs. Likely this came from his legs. As a matter of fact, he recovered, but in 2016, he did develop an overt blood clot in his leg, and he decided to retire. And Brandon Ingram is actually one who was diagnosed with TOS. You can see here in March of 2019, and he underwent resection of the first rib and had a successful recovery and did very well coming back to play. This, interestingly, are two other NBA players, but they were diagnosed with blood clot issues. And I think that what's happening now is because people who manage the athletes are afraid of their athlete getting the diagnosis of, quote, thoracic outlet syndrome, they come up with these other names for it, and they won't answer questions directly about thoracic outlet syndrome. This is actually what happened with Victor Wembanyama as well. All the media talked about blood clot, blood clot, blood clot, and it was very hard to find the information on what tests he had done, whether he had thoracic outlet syndrome, and whether he was going to get surgery. In fact, he did get surgery, and he's back now playing rather well. Damian Lillard is another example, another very good player. He had blood clots early in 2025. He got treated for it and came back for the playoffs. And then, sadly, he tore his Achilles tendon halfway through the playoffs. So let's go back to Victor Wembanyama. Anybody who's a sports fan has probably heard his name. He was drafted first overall in the 2023 NBA draft. You can see the numbers here. He's the first player in NBA history to record 2,000 points, 1,000 rebounds, and 200 three-pointers in his first 100 career games. It's unbelievable. He's amazing. Now, after he got diagnosed with a shoulder blood clot, this is one quote I took from the media. A person did a little research, found out how many miles each team had traveled, and it turned out the Spurs had traveled, I think, second most. I'm not sure this quote is exactly right, but either the first or the second most mileage of any other NBA team. And it was a lot higher than the teams who had traveled less. The only problem with that was he didn't have a blood clot in the legs. He had it in the shoulders. Remember, we've talked about this, what the risk factors are for this. Okay, so anyway, there are a couple of journalists that pursued it and dug deeper and actually did come up with some experts who suggested the diagnosis of venous thoracic outlet syndrome. But I thought from the moment I read that he had a blood clot that he had venous TOS. And here was my reasoning. Number one, ultrasound confirmed blood clot in the upper extremity, which already makes it a very narrow group of patients. He had none of the risk factors for upper extremity DVT, that's blood clot. He's young and he's male and he's never had a prior DVT or blood clot. And remember, that group of patients with venous TOS who have a blood clot in their upper extremity, they're different from the other large group who have some underlying factor like cancer. He didn't have any of those risk factors. Upper extremity DVT are not associated with plane flights. And his case is different than the other NBA players I mentioned who had leg blood clots or pulmonary embolism. So I thought all along that he had venous TOS. It was hard to confirm that for a long time. But eventually, when he was playing with the French national team, his coach there said, yeah, he's doing really well after surgery. And that was the first confirmation that he had actually gone through surgery. Now he's doing great, and I wish him the best of luck. Now let's talk a little bit about Major League Baseball players. Fortunately, compared to 20 years ago or 25 years ago when I was first starting with TOS, it's becoming more widely recognized. So we find a lot of baseball players, particularly players who are pitchers, catchers, third basemen, the people who throw the ball the hardest, who are being diagnosed. But unlike other athletes, baseball players can develop any one of the three types of thoracic outlet syndrome. These are players with neurogenic TOS. It's a longer list. These are players with venous TOS. And there are even a few players with arterial TOS. Okay, so these players, they can affect with the force they throw the ball and the high number of times they repeat this motion, they can damage any one of the three major structures of the thoracic outlet. Now, Zach Wheeler in particular, I personally am a Mets fan, and they had a pretty bad season. They started out great and then they flopped. But the Phillies just kept going strong the whole time. And late in the season, in August of this past year, Zach Wheeler was diagnosed, quote unquote, from the media, right upper extremity blood clot, unquote. But fortunately, after seeing the whole debacle with Victor Wembanyama, when everybody was chasing their tail about blood clots and not understanding the underlying context, several reporters got on this right away. This one right here, Stefania Bell, said, the most likely cause of clot formation in an elite athlete, particularly in the upper extremity of one who repeatedly subjects the arm to overhead stress, is thoracic outlet syndrome. So that's true, although you don't have to be an elite athlete. Now, I'm going to go back to one of the earliest, if not the earliest cases of TOS in a baseball pitcher. J.R. Richard pitched for the Houston Astros in the late 1970s. And you can see here, this is from the New York Times. In 1980, he had come off 2 consecutive seasons of 300 strikeouts. That's really pretty amazing. He had a very low ERA, and he had allowed only 2 home runs in 17 games. Batters were hitting 166 against him. Well, he had the unfortunate problem of developing an arterial blood clot, and the blood clot grew backwards until it reached the carotid artery, and a piece of it broke off, much like a pulmonary embolism. But because it was in the artery, it didn't go to the lungs. It went to the brain. He had a stroke and he never played again, unfortunately. So let's go over a few key points here. Blood clots of all types form most frequently in the legs, with long plane trips being one example of a factor that increases the risk factor for DVTs or blood clots. Pulmonary embolism, if you read about a player with a pulmonary embolism, it did not start in the lungs. It started elsewhere, and then it traveled to the lungs. And given the first paragraph here, it most likely formed in the leg and then went to the lungs. That's not thoracic outlet syndrome. Only 5% of all blood clots form in the upper extremities, and of that 5%, 70% are explained away by medical conditions like cancer or immobilization or recent surgery. But in young men having their first blood clot, you can say that venous TOS is more likely. And that's what I've got for right now. Herb, I'm going to stop sharing my screen and let's see if we have any questions about all that. So Randy is asking, are there methods to prevent getting TOS as an athlete? So I'm not aware of a way to prevent that from happening. I'm not even aware of a way to predict it happening. We know that compression of the vein is a part of developing a blood clot, but it's not sufficient by itself. As an example, I often quote a study done at Northwestern University in the 1980s, where they examined normal people and people with TOS, and they found that about half of people, normal people, would have compression of their large subclavian veins when they raised their arms above their head. When you looked at the patients with symptoms, about 66% of them had the same compression. So that's not statistically different. And in all the studies we've done, most patients will have some degree of compression of the veins. It just happens. What's the factor that turns compression into damage of the vein or into a hypercoagulable state where the blood gets too sticky right at that point? Nobody knows that right now. So the main thing is a venous blood clot in the subclavian vein usually shows up pretty easily. It's not a diagnostic conundrum. When an athlete or anybody shows up in an emergency room, if their arm is swelling or if it's dark red or purple or if it feels heavy, most docs should know they get an ultrasound to look at the subclavian and axillary veins. They don't even need to know the term thoracic outlet syndrome. They know that they look for a blood clot in the veins, and then the workup goes from there. Thank you for the question. Andre says, if I'm diagnosed with TOS, how long should it take for me to get back to my sport, which is tennis? Excuse me. In contact sports, assuming you're talking about venous TOS. I'll get to neurogenic in a second. In venous TOS, in contact sports like basketball, the leagues and the people, the all over the trainers, pretty much all agree that the patients go on this blood thinner or anticoagulant, and then they can't play because they could potentially have a minor trauma that bleeds too much because their blood doesn't clot so easily. So they normally get treated for a variable amount of time with a blood thinner. They don't play during that period. They have regular blood tests to regulate how thin the blood is. There's a certain range we accept. And when the clot is away, when it's resolved, and we can examine the underlying vessels with ultrasound, make sure there's nothing abnormal, then they can stop the anticoagulation and the player can come back after the anticoagulation resolves. Now, if you're talking neurogenic TOS, I found a few papers in the literature that statistically show the time gap between the first onset of symptoms and the date of successful surgery is a predictive factor for how much a patient will improve after surgery. That's only for the patients who undergo surgery. If you have a neurogenic TOS, Andre, there would be several factors your doctor would have to work up to see how severe it is. Usually there's a trial of conservative therapy like physical therapy, but it's the sort of thing that we help people with all the time. So if you reach out to us on tosmri.com, contact us, then we can talk more about the details and see where you are. And thanks for the question. Follow-up from Randy. You mostly mentioned vascular TOS to my question about prevention. Does that apply to neurogenic as well? So this is what I would say about that. I understand your question. Again, there's no way to prevent neurogenic TOS. I would say that the thing we've been working on for ages, raising awareness among, excuse me, among patients and doctors, has hopefully contributed a little bit to earlier diagnosis. If the symptoms are mild and they're recognized early, then what you might call prevention is actually just rapid addressing the symptoms, getting the proper conservative therapy, occupational therapy, if you work at a computer, for example, or if your job involves using your upper extremities a lot. So no, there's not a way to prevent it. I would just say we don't want to tell anybody to limit their activity. If they love rock climbing, go and rock climb. But early recognition of symptoms is a critical part of getting you in the loop to avoiding surgery, hopefully, getting the symptoms better, and then knowing in the future how to adjust when you start getting the earliest symptoms. And I hope that helps. Wayne in Edmonton asks, what physician specialty is the best first doc to see for TOS? It's a great question, and there unfortunately isn't a single answer for it. The best answer is see an experienced TOS specialist, somebody who has dealt with TOS before. This is for two reasons. An experienced TOS doc, if you don't have TOS, he or she will be able to say to you, I've seen TOS and this isn't it. Let's go do some other tests. But an experienced TOS doc will be able to do those special tests that a neurologist typically won't do and really try to nail down whether this is TOS, what kind of activities make it worse, and what the follow-up steps would be. So every city, if they have a TOS specialist, it tends to be a different specialty. Vascular surgeons predominate in some cities. Sports medicine docs may predominate in other cities. But if you reach out to us, we can connect you with many experienced TOS specialists around the country. And we have several good docs and good groups that we can suggest. I don't know if recommend is the right word, but we know they do good work. Thank you. Jeannie from Las Vegas says, I watched your videos in the past. Is there any difference from going to Emory or University of Chicago? you've had both on the program, and I'm considering both. Yeah, that's a great question. The people at Emory are a little bit advanced in time. Uh, that's Dr. Bowers, a sports medicine doc, and I think he's also a PhD, and Dr. Eric Wagner, tremendously experienced in upper extremity conditions, not just TOS. They're very valuable as a team, and they have staff that works with them, and they have a nicely organized approach to diagnosing TOS or ruling it out. So we love that place. We think they're doing super work. Dr. Ernest Chan in Chicago, uh, young, progressive, smart guy, seems to have all the right ideas. I think his program is in an earlier stage of development, and he's just tailoring it, creating it to solve the issues that he finds important. So I don't think you could go wrong with either place. Thank you. I'm going to see her if we have any other questions. All righty. So thank you everybody for joining us here again. Again, and forgive me for my asthma. Uh, this is Dr. Scott Worden, the TOS guy. We're always happy to talk about TOS, and we're happy to help everybody that we can. Feel free to reach out to us, tosmri.com. There's a big contact us button at the top, and there's a phone number to call. And we are happy to help people out with consultation or with our NeoVista scan, which we believe is a tremendous tool to help these TOS specialists around the country. So until next time, thank you, and we'll see you soon.